So if a patient does disclose that they went through some kind of trauma in their life, the most important thing to figure out first is if they're safe now and if they need any help to be safe or if they need resources.
I like to first just acknowledge what they said and thank them for sharing that with me. And then doing a quick check-in into how has that affected them to this point and whether they are interested in learning about resources to be able to address that more head-on if they are ready for that.
When a patient discloses a history of sexual abuse or sexual trauma, I really try to somewhat normalize and empathize with the patient, but explain that they're not alone, and many of our patients do present with similar situations or have had similar issues, and trying to normalize it for them, but at the same time recognizing their own personal trauma and how that affects their health outcomes as well.
So if a patient discloses trauma during the course of a sexual history, sexual health taking, the first thing I would do is empathize with them. Say, I'm so sorry that this has happened to you. Thank you for sharing. It must be hard.
I've also found that sometimes a patient doesn't disclose their most private sexual health history until they've established that relationship. And it may not be the first visit, it may be the third or the fourth, or sometimes even a year later before the patient will disclose some history of trauma.
I don't push, I don't prod. I open the space to be a safe place for them to talk. And even if they only disclose something very small about their trauma, they know that it's a safe place that they can come back to in the future. You don't need to know a lot of details about someone's trauma in order to help them with their trauma.
I think allowing the patient to dictate that conversation and really tell you how they want to address that and incorporate that into their visit is very important. That would also help you on your approach to your physical exam, in that you can actually have a more tailored physical exam that is void of surprises.
When a patient discloses something traumatic, in my personal practice, there's no cookie cutter script for it necessarily, but usually I show appreciation that they felt comfortable enough to share that with me, and I show empathy. I try not to take it much beyond that because the patient doesn't need to also deal with the burden of my feelings as well. After that, really, it depends on what the patient's needs are with regard to the trauma. Some people have worked through it. They've been on medication, they've talked to a therapist already, and it's just your job to be aware and take note of it. Other people are still working through it, and maybe your job is to hold their hand and just listen. Maybe it is to hook them up with a more trauma-oriented therapist in the future or encourage them to seek out a support group. That's, basically our role as the provider.
I think when a patient discloses a history of trauma or abuse, I think it's going to be dependent on the age and where that patient is at that point in time. If it's something that happened 10, 15 years ago, it's going to be a very different conversation. That's something that happened a few months ago.
The one thing to remember is that depending on the age of the patient, as mandatory reporters for child abuse, you will and may need to disclose that. And so if it is important for you to notify others, it's important for you to notify the patient that you have to do it because of obligation, and that you'll do everything to ensure that they're safe.
And maybe we do have to disclose to an adult in their lives, but I let them try to choose and in what setting that we may have that disclosure. So maybe they want me to be in the room with them while they talk about it, or perhaps they want me to talk with their parent or their caregiver separately.
The other thing is to ensure that you're giving them options. So some patients may not know that they can press charges or that they're being sexually exploited. And so it's important that if you have resources within your institution, within your community, that you're referring them appropriately. But that first encounter, you may not have all the information, and that is okay. But just ensure that you are doing the appropriate screening so that they're safe, offering appropriate prophylaxis, so preventative care, so whether it's birth control, pre-exposure prophylaxis, ensure that patients know their options. You are their knowledge source, and so it's important that you're giving them the information that they need, even if they don't know that they needed it.
So trauma is really difficult for both the patient and the provider asking those questions. The way I prepare for that is before I'm even in the exam room. Everyone in our clinic takes a very short trauma-informed module in order to learn the tools and skills to both identify a patient who may have suffered a trauma, as well as talk about it in a safe and empathetic way. As providers, we show our support for those patients that are being vulnerable in that situation by being strong and being the provider that they need in that moment.